歡迎大家。
Welcome to the press briefing. Today we have Dr. Chang Shuk-Kwan, Head of Communicable Disease Branch of the Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager, Hospital Authority. They will brief us on the situation at the HA as well as the positive cases. Dr. Lau, please. Good afternoon. First, I would report the situation of patients staying in HA's hospitals. 1,467 patients are staying in hospitals. 188 were newly confirmed cases. Of the patients in isolation facilities, 400 were staying in our isolation wards. 84 were staying in Tier 2 isolation wards. 431 are staying in the North Lantau Hospital, Hong Kong Infection Control Center. A total of 147 were newly confirmed cases. Yesterday, 2 more patients were reported to be in critical condition. 6 were in serious condition. Of the patients in hospital, 28 were in critical condition and 16 were in serious condition. 7 of the patients in critical condition were in intensive care. 4 new deaths were reported. All of them were males. They were aged 72 to 93 years old. Of the patients who passed away, 1 came from a residential care home. Of the 4 patients who passed away, 1 had no record of vaccination, and the other 3 completed their course of vaccination. One of the patients was a 72-year-old male. In the evening of August the 5th, he fainted at home, and his family called an ambulance, and upon arrival, it was found that his heart stopped beating. Resuscitation was attempted. He was transferred to the A&E ward of Pamela Yu Nedlesol Eastern Hospital, where resuscitation was attempted again, and a RAT was carried out, and the result was positive. Unfortunately, the resuscitation failed, and the patient passed away at the A&E ward. As a result, he was transferred to a public mortuary, and an investigation would be carried out. We did not know about the conditions of the patient before he was admitted to hospital. So for those with elderly family members who experience any discomfort, please carry out an RAT, and if necessary, please seek medical attention. And you may use the HA Go app to reserve an appointment at our designated clinic or telemedicine services. For the 3 other male patients who passed away, they were aged 82, 86, and 93 respectively. They all had underlying diseases, including hypertension, diabetes, hypolipidemia, chronic pulmonary obstruction, kidney or renal failure, etc. These patients had different chronic illnesses. Over the past day, 208 patients recovered, including 178 who were discharged from hospitals. 3 patients tested positive through admission screening or in-hospital testing. 4 patients or staff members in the same wards were listed as close contacts. For staff members, the total number of staff members who tested positive was 26,454. 25,897 have returned to their posts. That's all for my report. Good afternoon. Yesterday, we had a total of 4,322 locally acquired positive cases, 1,468 positive PCR results, and 2,854 verified RAT results. We also had 280 imported cases, 247 tested positive through PCR, and 33 who tested positive through RAT. As Dr. Lau said, today we saw 4 cases of death. Since the 5th wave started, the death toll is 9,322. Of the 280 imported cases, 120 were identified at the airport, 126 were found at quarantine hotels, 35 were identified after the patients left the quarantine hotels. Most of them were suspected reinfection since the CT values were high. The 280 cases came from 49 places. 9 places saw 10 or more cases, including 46 from UK, 32 from US, 19 from India, 17 from Singapore, 16 from the Philippines, 15 from Thailand, 12 respectively from Canada and Japan. The remaining places saw 10 or less cases. For the residential care homes today, 3 RCHEs and 3 RCHDs saw new cases, and some people had to be quarantined. These include 3 RCHEs, 輝圖中西結合安老院 in Kowloon City. 1 resident tested positive. 3 other residents had to be quarantined. 城市護老院第二分院 in Eastern District. 1 resident tested positive. 12 other residents had to be quarantined. 耆康會關泉護理安老院 in the Southern District. 1 staff member tested positive. 2 residents had to be quarantined. The 3 RCHDs include 基督教家庭服務中心誠信兒童之家 in 西貢. 1 resident tested positive. 2 other residents had to be quarantined. 明愛樂恩軒展能中心暨嚴重弱智人士宿舍 1 resident tested positive. 7 other residents had to be quarantined. 富康會啟泉之家 富康會啟康之家 1 resident tested positive. 3 other residents and 6 staff members had to be quarantined. Today is public holiday, but some classes from 2 schools had to be suspended for 1 week. These include the CCC KY Primary School in Mawan. In Class 2E, of the 25 students, 4 students tested positive. There were 25 in the class. The school is located in Chunwan, CCC KY Primary School in Chunwan. 佛教榮恩學校 in Yuen Long. On school bus number 25, there were 12 students and 2 of them tested positive. We are yet to identify the source of infection. The other students in the class will stop going to school for a week. We will continue to monitor the situation with the subvariants. The BA.4 and .5, we are seeing a rise in the proportion of the cases, and the latest percentage is 9.8%. For the suspected L452Q cases, they make up 7.3% of the total. So the BA.4 and .5 subvariants have overtaken the BA.2.2.12.1.
The floor is now open to questions. Please put up your hand as staff will pass you the microphone. Before putting your questions, please identify your media outlet. Questions? The journalist over there. What's your media organization? I'm from Cable TV. For malaria, today, another 30 cases are reported concerning malaria. Before these arrivals came to Hong Kong, were they infected or did they get infected in Hong Kong? Has the investigation been conducted for all arrivals from Africa recently? How many blood tests have been done? How many are in a critical condition? What further measures will there be to step up efforts in this regard? We are aware that a large proportion of the cases are arrivals from Guinea. For some cases, they are fellow travelers from the same company. They have arrived in Hong Kong, or they are about to come to Hong Kong. Over the past couple of days, for arrivals from Guinea involving people of the same company, we have obtained a list of these people. Tests have been conducted for these people at quarantine hotels. 90 people have been screened. 20-odd people have been found to have the malaria parasite, Plasmodium. They test positive to Plasmodium. Now, these people have been sent to hospitals for treatment. Yesterday, one flight where there were fellow travelers of these people, roughly 120 travelers, together with colleagues from the hospital authority and the Port Health Department, we conducted a screening there. We examined for symptoms. We also took blood specimens. Yesterday, for the 120-odd people, 13 tested preliminary positive to malaria. They have been sent to the HA's hospitals for treatment. For some other people, they arrived in Hong Kong earlier. They were fine in earlier screening or were outside the scope of our screening, but they fell ill, so they went to a hospital. That involves a number of people too. In places like Guinea, those places are places where malaria is prevalent. There may be outbreaks in those places. For people traveling to those places, they need to be on long-term medication to protect themselves from malaria. But some people have not taken the medicine on a long-term basis. Or for some people, they had recent infection, they had treatment. They may have caught malaria in those places. Now, over to the hospital authority. Now, I'll tell you the number of people at the hospital authority's hospitals. As at noon today, 58 malaria patients are staying at public hospitals. Among the 58 patients, there are 56 males, 2 females. They're aged between 25 and 56 years old. For the 58 malaria patients, 1 is in a critical condition under intensive care. 2 patients are in a serious condition. For the rest, that is 55 of them, they are in a stable condition. Our medical team is closely monitoring their condition and providing appropriate treatment for them. The speaker is not using a microphone. I don't have the information in that regard as to where they're staying. Next question. Right-hand side, front row. I'm from commercial radio. For those who have caught malaria, what's their nationality? Have all of them been sent to hospitals? And for their fellow travelers who arrived at Hong Kong, what will be done about them? The third question. Will flights be banned for those coming from Guinea in Africa? In terms of their names, most of them look Chinese, but I haven't dug deep into their nationality. For those who test positive during the test, they're now staying at the hospital. For some of them, they haven't obtained a result and they have left Hong Kong. We will notify the relevant parties in those cases. What was another question? for those arriving in Hong Kong on the same flight. Now, our practice is like this. As Dr. Chuang was saying yesterday, we worked together with the Port Health Department and conduct a screening for the travelers. Blood specimens were taken, tests were done. Those who test positive were sent to the hospitals for treatment. For some of the arrivals, they didn't test positive to malaria yesterday. We called them to check up on them to see how they are doing, to find out whether they have symptoms suggesting they have malaria, whether they are feeling discomfort. If they feel unwell, we can send them to a hospital early. As we said yesterday, one patient passed away. Today, there's another patient in a critical condition. They may have felt discomfort for a number of days, but they haven't sought medical attention. They may have dismissed the symptoms, something as like a minor headache or minor chills. I would like to make an appeal here. If you come from a place where there are malaria outbreaks and the condition is serious and you feel ill, you should seek medical attention as early as possible and let the doctor know where you have visited. The doctor will look at your medical history and perform diagnosis. Next question. On the left, the speaker is not using a microphone. I haven't heard of such plans. I'm from Now TV. For malaria cases, let me stick to COVID. The 72-year-old male who passed away. I didn't catch it. Did the 72-year-old get vaccinated? The second question, malaria. Will they be, that is arrivals from Guinea, will they be staying at the same quarantine hotel? Is there a risk for an outbreak at this designated quarantine hotel? Last question for me. How many are staying at the intensive care units? Do we have recovered malaria patients who have been discharged? We reported there were 10 or so reported. Do we have further malaria patients who have been discharged? Dr. Chuang, please. For the 120 travelers on the same flight from the same company or fellow travelers, we conducted a screening and then they were sent to the same hotel. As for other arrivals from Guinea, that is, if there are such cases in the future, we will check with them to see if they have symptoms, perform a health screening, and then recommend a blood test. For the 72-year-old who passed away, he has received jabs. The records show that he had 4 jabs. One malaria patient is staying at the intensive care unit in a critical condition. Based on the information I have so far, there may be some patients, a few of them, discharged over the past couple of days. Next question. On the left, the journalist over there. I'm from Ming Pao. First question for the CHP, malaria. In total, how many imported malaria cases have you seen? Do we have cases that have been picked up only after they have left the quarantine hotel? What have they been to in the community? How would you trace these people? Second question for the Department of Health and the CHP. Screening is done. Do you look at the places they've come from to see if they are from Guinea or are they from the same company? There are some cases that are from countries other than Guinea. Are we doing enough to find them? Is there triage at public hospitals for arrivals from Africa? Do you have enough beds in intensive care units to cope with the situation? And for the death cases, the 72-year-old male, did he have underlying illnesses?
Most of the cases we saw came from Guinea, so we would focus on travelers from Guinea. In the past, we did see sporadic imported cases of malaria. If we see a large number of imported cases from certain places, we might adopt other measures. All of our cases were found at the airport or quarantine hotels, and many of these travelers would leave Hong Kong immediately after quarantine. So we did not see any cases among those who have left the quarantine hotel. We are now seeing two types of patients. One, those who had blood tests taken at quarantine hotels, and they would be screened by the Port Health Division. Some of them might not have any symptoms, but the blood test results show that the samples tested positive to Plasmodium, and the patients would be subject to further tests in the hospital. There would be microscopic examination of the blood samples to see if Plasmodium is detected. Another type of patients are those who experience symptoms. They would be transferred to an A&E ward. Some of them had headaches, fever, muscle pain, abdominal pain, etc. So these were symptoms of malaria. But these were rather common symptoms, so we would need to examine the medical and travel history of the patients. That is, whether they had visited places where malaria is prevalent, such as Guinea in Africa, and if so, we would pay extra attention. For those returning from Guinea, for example, we would conduct blood tests immediately to confirm whether he has malaria. If so, we would prescribe medicine. A reporter asked about the situation at a single quarantine hotel. By placing patients in a single quarantine hotel, that would facilitate management. But in Hong Kong, malaria is not transmitted through air or the respiratory tract. The disease is transmitted through a vector, that is mosquitoes. There are no mosquitoes in urban areas of Hong Kong that would transmit malaria, so the risk of transmission in the community is very low. Next question, please. Good afternoon, this is TVB. I have a question about malaria. How many inbound travelers do you expect to come from Guinea? And if they are treated in hospitals, are you wary of the risk of an outbreak? We do not know how many more inbound travelers we will see, but there will be around 200 travel collaterals arriving in Hong Kong, and there will be others who do not belong to the same company. This type of mosquitoes is not found in the urban areas of Hong Kong. As Dr. Huang suggested, malaria is transmitted through a type of mosquitoes known as Anopheles, and according to the FEHD, this type of mosquitoes is not common or not present, but nonetheless, we have raised our mosquito alert index to the highest level. we would apply larvicidal oil and other chemicals, since there are other mosquito-borne diseases such as the dengue fever, and in the summer, especially the rainy season, the various HA organizations would reinforce mosquito control. For the 72-year-old male patient who passed away, he was suspected to have dementia, but according to the medical records, he had no other underlying diseases. This is the end of the press briefing. Thank you.